Welcome to the deep dive. We're here to cut through the noise, distill complex info into those vital, maybe surprising insights you need. Today, we're taking a really deep dive into something profound: how traumatic brain injury, TBI, affects the brain, and, well, how it affects our sense of self. We're working with some fascinating, really eye-opening material from the Traumatized Brain, a family guide by Vani and Sandeep Vaishnavi. Our mission: to unpack brain injury, from the basic mechanics to those far-reaching effects on mood, memory, behavior, and crucially, what can actually help with recovery. You might be surprised, actually, why even seemingly minor head injuries can have long-term consequences, and how research is shifting our whole understanding. It's quite a journey. We all kind of intuitively get that the brain is special, but this book really drives home its role as the conductor, the maestro, coordinating the whole orchestra of the body. It controls everything, right? Heartbeat, consciousness. So what happens when that maestro is traumatized? What's the foundational impact there?
Well, what's great is how the authors really simplify this incredible complexity. They remind us it's built from billions of neurons, nerve cells, and maybe even more glial cells. Those aren't just support anymore, they actually help with processing power. We're talking about the core bits, the cell body, dendrites grabbing signals, axons sending them out, and that crucial gap, the synapse where the signals jump.
Okay, so you've got the basic wiring, movement, sensation, things like that. But the authors really spotlight these higher order circuits, the ones that make us, well, us. Mood, thinking, memory, impulse control, personality, consciousness itself. So if those circuits get damaged, what does that even mean for our identity? It feels huge.
It is huge, yeah. And the book uses this powerful analogy. Think of the brain as the hardware. And our behaviors, our emotions, that's the software. But even the best software, it can't run properly on damaged hardware. Now, this doesn't minimize the human spirit, not at all. It just means that for our plans, our dreams, our intentions to actually happen, the brain's infrastructure, especially those higher order circuits, needs to be working. Our thinking, emotions, behavior. It's nature and nurture, sure, but the brain's physical state is the absolute foundation.
That hardware analogy really helps. Okay, so let's dig into that hardware more. The where and how of the injury. The book talks about white matter and gray matter. Can you break that down? Why does that distinction matter so much for TBI?
Absolutely. So think of two main types of brain tissue. Gray matter, that's where the processing happens. Yeah. Packed with neuron cell bodies, glial cells, synapses, the thinking centers, basically. Then you've got white matter. It's made of the long axons, the wiring, connecting different brain areas. These axons have insulation, myelin, which helps signals travel fast. So gray matter is like the computer chip, white matter is the high-speed cabling. Now, when we look at specific regions, the book helps map it out. The brainstem, deep down, vital for survival. Breathing, heartbeat, staying alert. Damage there is often critical. Then the thalamus, kind of like a central relay station. Almost all sensory info passes through it: sight, sound, touch. It filters too, so damage can cause real confusion. And the hypothalamus, tiny but powerful. Regulates basic drives: hunger, rage, sex drive. Plus it controls our hormones. Moving up to the bigger areas, the lobes. Each has a specialty. Occipital lobes, the back. Vision. Cerebellum, tucked underneath. Coordinates movement, balance. That's why alcohol hits it hard. But also seems involved in coordinating thoughts, maybe even speech. And then the big three up front. Frontal, temporal, parietal lobes. The prefrontal cortex right at the front is so crucial for executive functions. Planning, decisions, impulse control, personality, a lot of who we are. Temporal lobes are key for memory, emotions. Parietal lobes handle our sense of space, navigation. It's really an intricate network.
It's incredible. Okay, and here's where it gets, well, really interesting to me. The book explains TBI isn't just one thing. It's a spectrum, right? Mild to severe, often classified by unconsciousness or memory loss duration. But what struck me, maybe alarmed me, is that mild isn't always mild in the long run, especially with repeat injuries. So what are some specific ways these injuries actually happen inside the skull?
You're right. That point about mild TBI potentially being serious is a key takeaway. The book details a few critical injury types. First, coup contra coup. Imagine, say, a car crash. Your head hits the dashboard. The brain slams against the front of the skull, that's the coup. Then it bounces back, hitting the back of the skull, it's the contra coup. Damage at both impact points. And the frontal and temporal lobes. They're particularly vulnerable because of some bony ridges inside the skull. This can lead to these profound, but sometimes really subtle changes in mood, behavior, personality, things that might not show up immediately.
Right, even if the person seems okay physically at first.
Exactly. Then there's bleeding. Bleeding within or around the brain. These are hematomas, collections of blood. An epidural hematoma just under the skull. Often arterial bleeding. That's usually a fast, life-threatening emergency. requires immediate surgery. Intracerebral hemorrhages are bleeding inside the brain tissue itself. Common frontal, temporal lobes after bad impacts can cause seizures too. The real danger with any bleeding is increased pressure inside the skull. That pressure builds.
And that's really dangerous.
Extremely. If it gets too high, it can push the brain down, squeeze the brainstem. That's called herniation, and it can be fatal. And finally, something called diffuse axonal injury, DAI. This one's sneaky. It can happen without even a direct hit to the head. Think whiplash in a car accident or violent shaking like shaken baby syndrome. The brain moves rapidly back and forth. Those axons, the white matter wires we talked about, they get stretched, torn, sheared. If it's severe, it can cause coma, even death. But even in milder forms, DAI can cause those subtle TBI symptoms, and it often doesn't show up well on standard CT or MRI scans.
Wow. So it can be hidden damage.
It can be. Though newer techniques, like diffusion tensor imaging, DTI, they're getting much better at detecting this kind of white matter damage.
Okay, so the damage can range from obvious bleeds to these subtle diffuse injuries. It seems like it's often the emotional and behavioral changes that are the hardest for people and their families to, well, grapple with. The book really underscores how fundamental these shifts can be: depression, anxiety, mania, apathy, psychosis, aggression, impulsivity. What does this actually mean for someone living with TBI day to day?
It means their whole world and the world of those around them can change dramatically. And it's crucial to understand these aren't character flaws. They're symptoms stemming from brain changes. Let's touch on a few. Depression, very, very common after TBI. The book links it to damage in emotional regulation circuits. Maybe the brain's brake system in the front isn't working right. And it's not just feeling down, it has biological effects. Inflammation, stress hormones. The good news, treatments work. Medications like SSRIs, common antidepressants, can help circuits regrow. And therapies like CBT, cognitive behavioral therapy, teach new thinking patterns. Lifestyle matters too: exercise, diet, big impact. Then there's anxiety. Often shows up as agitation, irritability, maybe anger, especially if someone struggles to communicate or manage daily tasks. Again, CBT is really helpful here. Learning to reinterpret situations, using techniques like deep breathing, yoga. For caregivers, recognizing triggers, offering support without judgment. That's vital.
That makes sense. What about mania? That seems almost like the opposite of depression.
It can seem that way. Mania is this state of really high energy, needing less sleep, thoughts racing, being impulsive. This can lead to reckless stuff. Big spending sprees, risky behaviors. This is a medical emergency. Needs immediate evaluation, treatment with mood stabilizers, maybe antipsychotics. Another really tough one is apathy. This is not laziness. It's a direct TBI symptom. A profound lack of motivation affecting emotions, behavior, thinking. It really stalls recovery. Caregivers absolutely need to see it as brain-based, not defiance.
Right, not laziness. That's important.
Crucial distinction. And sometimes TBI can even trigger psychosis. This means things like paranoid delusions, fixed beliefs about being watched or targeted, often made worse by memory problems, or frightening hallucinations. Severity of the TBI, family history, those increase risk. Antipsychotic meds help by balancing brain chemicals like dopamine. For people interacting with someone in psychosis, the book advises validating their distress, not arguing the delusion. Making them feel safe is key.
I can only imagine how frightening that must be for everyone. What about aggression and impulsivity? They sound particularly disruptive.
They certainly can be. Aggression often comes on suddenly, and the person often deeply regrets it afterwards. It might happen in a state of confusion right after injury or later on. It's linked to damage in those brake circuits, often in the front and side parts of the brain, the orbital frontal and anterior temporal lobes. These normally help regulate impulses coming from deeper emotion centers like the amygdala. It's fascinating. The book connects it to brain chemicals too. Neurotransmitters like norepinephrine, dopamine, serotonin, even a genetic link involving an enzyme called MAOA. The book suggests a practical approach for caregivers. Look at the ABCs. Antecedents, what triggers it? Behavior, what does it look like? Consequences, what happens after? Does anything accidentally reinforce it?
ABCs. That sounds like a useful framework.
It can be very helpful. And finally, impulsivity. Huge challenge. TBI often makes it worse. Combine that with substance use, you get a really vicious cycle. The book is very clear. TBI patients should strongly consider abstaining completely from alcohol and illicit drugs, including street marijuana, because you just don't know what's in it or how it'll affect a vulnerable brain.
That's a critical point about substance use. Yeah. Okay, so we've covered the brain basics, the emotional impact, but the book also highlights how TBI affects everyday neurological functions. What about those common physical and cognitive challenges?
Great point. Because beyond the mood and behavior, these physical and cognitive symptoms can be incredibly disruptive.
Take sleep problems. More than half of TBI patients struggle with sleep. And poor sleep just makes everything else worse. Irritability, anxiety, memory fog. Causes vary. Direct brain injury, pain, medications, environment. The book really emphasizes strict sleep hygiene. Consistent schedule, avoid caffeine late in the day, cool, dark, quiet room. It's often foundational to improving other symptoms.
Sleep hygiene.
Right.
Makes sense.
Then attention. It's not just one thing, is it? It's selective attention focusing on one thing amidst distractions. Sustained attention, keeping focus over time. Divided attention, juggling tasks. All of that can be incredibly hard after TBI. So environmental changes help. Reducing distractions. Keeping a predictable schedule. Getting enough sleep. Those are vital. And memory, of course. Major concern for many. The book distinguishes explicit memory, consciously recalling facts, events from implicit memory, unconscious learning, like skills, habits, riding a bike. Some meds that boost brain chemicals are sometimes tried, but the book suggests results are often mixed. Memory is complex to repair. Maybe one of the most frustrating is executive function. Our ability to plan, organize, solve problems, monitor ourselves. Difficulties here can be really subtle. And sadly, they often get mistaken for stubbornness or laziness.
Yeah, I can see how that would happen.
Right. So the book stresses caregivers need immense patience. Provide structure, consistency, break tasks down into small steps, use positive reinforcement. And finally, language, aphasia. Damage to language circuits, usually left hemisphere for most people. Can mean trouble speaking clearly even if understanding is fine. That's non-fluent aphasia. Or they might speak fluently, but it's jumbled, nonsensical, and they don't understand well fluent aphasia. But here's that fascinating detail the book points out. The other side of the brain, the non-dominant side, handles the emotional tone of speech. So someone with severe trouble forming words might still be able to curse up a storm or even sing a song fluently, because those are processed differently.
Wow, that singing example really does bring it to life, shows how specific the brain is.
It really does. And speech therapy is crucial. And importantly, thanks to brain plasticity, recovery can continue much longer than we used to think.
Okay. And it's not just the core brain functions either. TBI often leads to other neurological issues too, right? Headaches, seizures, vision problems.
Exactly. Those are very common comorbidities. Headaches are incredibly frequent, especially after mild TBI. Often feel just like migraine sensitivity to light, sound. The book mentions other types too, but the key thing is persistent, severe headaches, especially with vomiting, that could signal dangerous pressure inside the brain. Needs urgent medical attention.
Okay, red flag there.
Definitely. Then seizures. That's when the brain's electrical system misfires. Causes a chaotic surge. Can lead to loss of consciousness, muscle convulsions. If it's someone's first seizure or lasts more than a few minutes, call 911 immediately. The book gives important safety advice too. Gently get the person to the floor, turn them on their side, never put anything in their mouth.
Good practical advice. And vision.
Vision problems are often overlooked. Could be anything from light sensitivity, blurred or double vision, to trouble moving the eyes together. In rare cases, you might see something called unilateral spatial neglect, where the person is completely unaware of one side of their world, often the left side. It's quite striking. Providing support for these sometimes frightening visual changes is vital.
This really paints a picture. TBI isn't just one event. It's this complex condition affecting every single facet of life. And the book really emphasizes recovery as a journey. And a big part is accepting the psychological trauma of it all. This sudden, life-changing thing. It's not just physical healing.
Absolutely not. And the book offers these really powerful practical strategies, often shown through patient stories, which is great. One key step, making sure doctors have all the medical records, accident details, past history, meds the patient might not remember accurately. Good records prevent wasted time, ensure better care.
Right, getting the full picture.
Exactly. Another great strategy, having a medical advocate or companion, a family member, a friend, someone who goes to appointments. They can offer insights into mood, behavior, cognitive slips that the patient themselves might not even be aware of. They become the patient's crucial observer and memory aid.
That makes so much sense, having that second person.
It's invaluable. And then, safety first. Always. Knowing when to get immediate professional help. Sudden, dangerous changes in mood or behavior. Any risk of violence, call 911. Don't hesitate. Adherence to treatment is huge, too. Consistently working with the person, making sure they take their meds, follow therapy advice. It's hard. Challenges will come up. Support groups can be incredibly helpful here.
Yeah, finding that community.
Absolutely. And the book strongly pushes for self-education, for the person with the TBI, for the caregivers. Understanding the injury, what to expect, the do's and don'ts, it's foundational. Knowledge is power here. And finally, maybe most importantly for the future, preventing a second injury. This is critical. Simple things, helmets, seatbelts, and again, completely abstaining from alcohol and illicit drugs, especially street marijuana with unknown potency or contaminants. Protecting that recovering brain is paramount.
So this deep dive really shows TBI is incredibly complex, affects everything, but also that a holistic, informed, and incredibly patient approach can make a huge difference in outcomes. It really highlights the brain's resilience, the human spirit's resilience too, but also just how profound that link is between the physical brain and, well, our personality, who we are.
It really is powerful. And building on that, the book really drives home that recovery often isn't about getting back to normal. It's more about finding and accepting a new baseline, and then building a meaningful, fulfilling life within those new circumstances. Kind of makes you wonder, doesn't it? In what other areas of life might understanding the intricate hardware of our bodies really shed light on the complexities of our software, our behaviors, our experiences, maybe even our identity itself?
That's a great question to ponder. Thank you for joining us on the Deep Dark today. We really hope this exploration of the traumatized brain has given you some new insights, a deeper understanding of this challenging but also hopeful journey. Keep that curiosity burning, and we'll catch you next time.